where the Minister speaking after a record 931 patients on trolleys. So we've blasted through that just over 700 record that have been set in December.
It's shocking. It's shocking, and yet here we are again. I mean, how many times have I been on here with you guys talking about this? What I just find so surprising is it was so well flagged. It was so well flagged for months that there was this triple-demic, you know, these viruses circulating that perhaps people weren't as immune to as they would have been a couple of years ago because we weren't mixing. And COVID and these ongoing issue we have with capacity. And I mean, obviously, University Hospital Limerick has been written to the Minister in July saying this is a serious problem. So I can't understand how this is still, how this has come out of the blue for them, you know, when it has been so well documented. I mean, the problem with the overcrowding is that it's the rest of the hospital that's full. So you can't move people from the emergency department in there. So you have to treat people, triage them in a waiting room, sitting on a chair, maybe on a trolley if you're lucky, if you're one of the lucky ones on a trolley at this stage. And it's funny because we hear about the NHS and people in the UK freaking out over the way that is buckling under the pressure. And it's like, wow, guys, that's just a regular Tuesday for us here in Ireland.
Well, I mean, like Philny Head, the INMO chief yesterday, she said, we need to know what the plan is. Telling people to avoid hospital, it's not a plan, it's not safe. And you kind of fear for people, elderly people, who have a fall or who have, you know, a chest, you know, they're worried to have a heart attack, whatever else. Well, and will they be feared? I mean, I don't want to go to A&E because I don't want to be stuck there in a chair for hours. This
has been pointed out that there's late presentations for very serious things like cardiac problems and stroke. And, you know, the difference is that older people as well, they are the type of people who will be reading the newspapers and listening to the radio and hearing the message not to go, and they will stay away. And, you know, it's not, Philny Hay from the INMO saying as well, you know, it's not a plan. It's not a plan because you could go to an injury clinic and they'll say, well, you've got some sort of respiratory thing going on and we can't look after you here.
The thing is, these people who are waiting on trolleys are not just numbers. They're someone's daughter, they're someone's mother, they're someone's father.
It's so stressful to watch them.
But there are just over 11,350 acute beds. This was in 2022. When we finally got back to 2009 levels, there was over 6,000 more beds in Ireland in the early 80s. When we had no money, so forget about our austerity, there was more than 6,000 more beds in Ireland. But our population has now increased by, what are we up by? Almost over 500,000 people have increased in population.
We don't plan in this country.
But this isn't a surprise to them. They know this. They know we don't have enough
beds back then needed less workers around them. I think they need more staff, more nurses, more, and like that.
No, but I totally and utterly understand that. But the fact is that this is not a surprise. They have the figures. They know that we had 6,000 more beds. They know that our population has increased. They're the ones who are doing all of this. So it's not a surprise. It just feels that it's like, oh, health will never be solved.
Yeah,
so
and we can all jump up and down about it, but, you know, who can fix it? And the thing is, we do need someone to come in and project manage the whole country.
It's called a Minister for Health, I think. Isn't that what they're meant to do?
No, but I mean, listen, but they just pour, millions gets poured into this. It's a bottomless pit.
Yes,
and
it is. I mean, you don't...
Where do you start?
Well, for instance, I think it was Professor Declan Lyons from UHL was speaking yesterday saying that, you know, there was a man who collapsed in his home in West Clare who was brought to Limerick, who was then brought back to Ennis. So what, you know, what's the point in that? He was on a trolley for 3 days only to go to the hospital he should have gone to in the first place.